So what is piriformis syndrome? So the piriformis muscle is located deep in the buttock, so it's beneath glute max. So piriformis syndrome is a clinical condition and it's a neuromuscular condition that occurs when the piriformis muscle becomes tight and inflamed and then compresses or irritates the sciatic nerve. So as the muscle becomes tight or inflamed, this then compresses and irritates the sciatic nerve, which can result in the tingling and numbness that typically radiates from the glute down the back of the leg, which can then mimic other conditions such as sciatica as it shows similar symptoms. So the sciatic nerve most commonly runs underneath the piriformis muscle. So the nerve travels from the spinal cord through the buttocks down the back of each leg. So here the muscle and the nerve are adjacent, and this proximity is why and where sort of the trouble can then develop. So the symptoms experienced by a client are quite broad. So clients may report that they have a deep, dull or sharp pain in the gluteal region, or pain that radiates down sort of the posterior side of the thigh, which again can mimic sciatica and the symptoms associated with sciatica. They might experience numbness sort of along that posterior thigh, also along the sciatic nerve sort of distribution. They may have increased pain with prolonged sitting, sort of stair climbing or any hip rotation. There will be tenderness on palpation of the piriformis, sort of more superficially glute max, deep within piriformis. Within the glute, so there might be a possible reduction in sort of hip internal rotation and overall range of motion. Clients may also experience pain when they're seated for prolonged periods due to the compression on that area, and there might be decreased range of motion sort of in the hips, so hip flexion, extension, internal and external rotation. They may have instability when they sit for long periods of time, and the pain in the sort of buttock area might worsen when doing sort of specific hip movements also. And previously mentioned, as the sciatic nerve just runs adjacent to the piriformis muscle, which functions as an external rotator of the hip. So hence when the piriformis muscle is irritated or inflamed, it also affects the sciatic nerve, which mimics sort of that sciatic like pain. So the sort of symptoms and what clients may report, if you like, sort of ranges from that. But it's mostly sort of in the hip region, down the thigh, that they will, and sort of the glute region, that they will sort of explain their sort of symptoms and where they're occurring. And just to add to that, actually, the difference between piriformis syndrome and sciatica, obviously they're completely different conditions, but as you say, they mimic, piriformis syndrome almost mimics sciatica. That sciatica usually, that numbness and sharp pain running down the sort of leg. Usually if it's sciatica, it runs right down to the sort of bottom of the foot. Whereas piriformis syndrome runs and sort of stops just above the knee. Sort of you can distinguish both of them in that sort of sense as well. So justifying the use of two different massage techniques, and then I'm going to state how they help the condition. So proprioceptive neuromuscular facilitation stretching, also known as PNF, is used to improve flexibility and reduce tension in the glute, specifically in the piriformis muscle, which lies deep within the gluteal region. So tightness in this muscle can lead to compression of the sciatic nerve, as previously mentioned, cause pain and tingling and reduce mobility. So how PNF helps the condition. So PNF stretching combines isometric contractions with passive stretching. So it takes advantage of the post-isometric relaxation. So the muscle relaxation following the isometric contraction allows for a deeper stretch. Reciprocal inhibition, so activating antagonist muscles to encourage the target muscle to relax. And then the inverse stretch reflex, which is mediated by the Golgi tendon organ, which allows the muscle to relax when tension becomes too high. And lastly, neuromuscular re-education. So it improves motor control and coordination by retaining muscle activation patterns. So by stretching the glute, specifically the piriformis, the technique reduces muscle compression on the sciatic nerve, enhancing range of motion and restores balanced hip function. So why we do PNF in this region is obviously the piriformis lies beneath the glute maximus, glute max, and can become really tight and overactive, especially in people with like poor pelvic alignment, sedentary habits, or asymmetrical movement patterns. So targeting this region directly addresses the source of the sciatic irritation, so aiming to relieve pain and restore function and reduce tightness of the piriformis and prevent reoccurrence. So PNF stretching is also really excellent for targeting specific muscle groups, and as previously mentioned, increasing flexibility and range of movement. So this in turn will relieve pressure on the sciatic nerve, and restores optimal length tension, motor control of the specific muscle, in this case the piriformis. And lastly, I'm just going to justify why I use trigger point therapy on the piriformis muscle. So trigger points in the piriformis can refer pain to the posterior thigh, so again closely mimicking sciatic symptoms. So by applying a trigger point specifically on an area that's quite tight, or is like quite a taut band that's causing referred pain, causes an ischemic response. So applying a sustained ischemic pressure on these points then deactivates taut bands, which reduces referred pain. It reduces sort of inflammation and promotes a neurological reset of the muscle's firing pattern as well. So essentially it restricts the blood flow to the area when the trigger point is on that area, and when it's taken off, all the blood rushes back with nutrients and oxygen to sort of restore the muscle's normal function. So why we do trigger pointing in this region, we can reduce referred pain essentially that's running down into sort of that thigh, and reduce tightness in the piriformis itself. So we're reducing hypertonicity in the tissues to help with blood flow by causing ischemia to the area, and then obviously, as I explained, blood will rush back to the area, helping the oxygen and nutrient uptake for tissue healing. And then obviously that then triggers a sort of relaxation response once the trigger point is taken off that area. So common reasons why piriformis syndrome is caused could be due to hip pathology, pelvis dysfunction, being sat for long periods of time, could be attributed to obviously your individual gait cycle, overtraining, especially in runners, poor posture or biomechanics, so leg length discrepancies or poor pelvic alignment. Specifically to the area, it could be overuse or repetitive stress. So again, prolonged sitting and repetitive movements such as running and cycling or stair climbing. And it could even be due to excessive hip external rotation sort of during a sport. And lastly, it could be muscle imbalance or weakness. So weak glute muscles or core causes the piriformis to sort of compensate, and tight hip flexors pulling the pelvis into an anterior tilt. So it alters piriformis mechanics. And actually, direct injury or trauma to the area as well, such as like a fall on the gluteal area, or like a hard impact.